In this video, I'm going to show you a movement exercise for your hip. This is going to be very different to stretches you may have seen in the past or any strengthening exercises. We're going to look at gaining quality of movement in your hip joints. And the reason why this is important is because if you don't move an area of your body well, this can then relate to pain. And I'm going to explain this in this video as well. So let's get started. Hello, my name's Dr. Stephen Hulme. I'm a chiropractor based in Reading, and in today's video we're going to be looking at a movement exercise for your hip. When we've got an area of the body that doesn't move correctly, this can start to produce pain. And the reason why it produces pain is because every part of your body should be getting constant information going to your brain, so that your brain then can give accurate information coming back so that you move that area. If an area is not moving properly, or there's a lack of motion in a certain area, then the brain is not going to be as aware of that area of your body, and there's going to be a bit of a discourse between the information it gets back and the information it's sending. And so the information it starts sending to move that area of the body is not going to be then as accurate, and that discourse then can start to produce pain. So we're not going to look at stretching the area, we're not going to look at strengthening the area in this video. We're going to look at gaining proper quality of motion to get that area moving symmetrically and more smoothly. So we're going to start this exercise in the standing position. Now, if you find this very difficult in the standing position, then you can do this lying on your back as well. So we're going to start by doing some simple circles. And you're going to start this in the neutral position. So you can imagine you're drawing a circle on the floor with your toe. Do this quite slowly to begin with, and then as you start to gain a bit more confidence and you're sure that you're getting that quality of motion and that symmetry within the circle, you want to produce the most perfect circle that you can do. And it doesn't matter if you're not very good at the beginning, because the whole point of it is that you improve over time. And once you can do that, then you can then start to go a little bit faster, but stay on the slower side rather than the faster side. I would say do this for a number of times in one way. You could do this 5 times, 10 times, 15 times one way, and then you can go the other direction. Then after you've done that, we can start to do the same thing, but do it with the hip in different positions. So we can start to do it in flexion, so bringing your hip forwards and doing the circle there. We can start to do it backwards, so an extension, and doing the circle behind you. We can then do it with your hip or your toe out to the side, so abduction, and we can do the same thing with your hip or toe off to the inside, so adduction, and doing the same thing. And then we can start to combine it, so we can start to do then flexion and abduction, so out to the side and forwards, and then we can do flexion and adduction, so out forwards and into the middle. And then we can do it behind you and out to the side, so extension and abduction, and then we can do extension and adduction. Which position you do really depends on how well you can do them. So my suggestion is to try each one of these positions, and the position that you struggle with the most, or the one that you find the hardest, focus more on that to get that as good as you can. If you're seeing a practitioner such as a chiropractor, then they're going to be able to tell you what position is going to be best for you based on what you struggle with the most, or what restrictions there are on the hip, or what dysfunctions you have in the hip, and they're going to be able to tell you which one's going to be most beneficial. If you're not seeing someone like a chiropractor, then you can just find that position yourself by just finding out which one you're not able to do as well. Maybe you can't do that circle as symmetrically, or maybe the movement isn't as smooth as the others, and you can then focus on that one. Once you master the circles, then we can start to make the movement a bit more complex. So now we can start to introduce some figure of 8 patterns. So this is basically an 8 that's been flipped onto its side. So again, with the toe, you can imagine that you're drawing that figure of 8. And again, you want to do that as symmetrically as you can and as perfectly as you can. And you can start small, and you can then start to make that figure of 8 a little bit bigger and make it as big as you can. And then again, you can do that in the positions that we spoke about, and you can find out which ones you're finding harder, and then perhaps focusing on that. And then lastly, we can do internal and external rotation. So again, we can start off in neutral and then you just turn in the hip inwards. And for this one, you'll imagine that if you've got your socket here and your hip here, you'll imagine the hip in your socket and you're turning it inside that joint. So as you're moving a hip, just imagine the hip turning. You can bend the knee if you need to, but the focus should be on the hip and just moving the hip. What you don't want to do is move your body or move your pelvis. So keep your pelvis still, only move the hip. And move it as far as you can one way. So external rotation and then internal rotation. If you have any pain with any of these motions, try to avoid doing that particular motion. It is important that you do these exercises without pain. If you start doing it with pain, you're just going to be reinforcing those pain pathways and potentially making the problem worse. So this isn't the kind of problem that you want to work through the pain with. So stay out of the pain, and even if you have to make that motion really small. And then over time, as you find that bit easier, you then hopefully be able to then move into an area that was painful that is now no longer painful, and you just start to extend that barrier a little bit. So give these exercises a try. Any questions, as usual, just pop them down in the comments, and I will see you on the next video. Take care and bye-bye.